Um, Hello everyone. So we are group 4. Today we will present about the disease named human papillomavirus, uh, can call SPV for short. It will be presented by me, Hoa, uh, Chaz, Zyong, and Satesh. This is our outlines. We will talk about what is the disease about, how it's spread, who usually involved or more affected, and lastly is what are the preventions. So about the definitions, um, basically human papillomavirus (HPV) is a virus that is spread from person to person by skin-to-skin contact. There are over 100 different types of HPVs, with more than 40 of them being transmitted through sexual contact and affecting one genitals, mouth, and throat. Um, um, Thirdly, HPV is the most common sexually transmitted infection (STI), according to Centers for Disease Control and Prevention (CDC). Therefore, it's so prevalent that even if they only have a few sexual partners, most sexually active people will experience it at some point. In fact, there are some incidents of genital HPV infections that do not result in any health issues. Some HPV strains, on the other hand, can cause genital wart and even cancer of the cervix, anus, and throat. So that's all my presentations. I will pass to Charles and he will introduce with you how the disease uh, will be uh, will be spread.
How does HPV spread? We can look into HPV through causes and factor of it. HPV infection occur when the virus enter your body, usually through a cut, abrasion, or a small tear in your skin. The virus is then transferred primarily by skin to skin contact. Secondly, genetical HPV infection are contracted through sexual intercourse, anal sex, and other skin to skin contact in the genetical region. Some HPV infection that result in oral or upper respiratory are contracted through oral sex. The HPV factors are number of sexual partners. The more sexual partner you have, the more likely you are contract a genetical HPV infection. Having sex with a partner who has more multiple sex partner also increases your risk. Age. Common warts occur mostly in children. Genetical warts occur most often in adolescents and young adults. Causes of HPV infection also can be if you are pregnant and have a HPV infection with a genetical warts. It's possible your baby may get the infection. Rarely, the infection may cause a non-cancerous growth in the baby voice box. Lastly, warts are contagious. They can spread through direct contact with the warts. Warts can also spread when someone touches something that already touches a wart. Other factors of HPV is damaged skin. Areas of skin that have been punctured or opened are more prone to develop common spots. Lastly, weakened immune system. People who have weakened immune system are at greater risk of HPV infection. Immune system can be weakened by HPV or AIDS or by immune system suppressing drugs used after organ transplant.
Hi, I'm Zyong, and I'll be take over our second question. Our second question is who is usually involved or most affected? For STI, Anyone in this world can become infected. However, the young women around ages of 15 to 24 and young men ages 20 to 29 are most affected. They are high risk for STIs because they have biological changes during the teen years that increase their risk for getting an STI, and they may be more likely to have unprotected sex. Female or male has higher risk. Study found that women have higher biological risk for contracting STIs and HIV than men, with a higher probability of transmission from men to women than vice versa. A woman a woman's anatomy is more exposed and vulnerable to STDs than male anatomy, as her vagina is thinner and more delicate, making it easier for bacteria and viruses to penetrate. That's all from me.
Hello everyone, my name is Satesh and I will be talking about the preventions of HPV. So, the first way and the most easiest way is to practice safe sex, which is the use of any contraceptives such as condoms or a female condom. Any contraceptives that avoid skin on skin contact is a perfect way to avoid HPV. Another way is to limit the number of sexual partners, which shouldn't be an issue in a conservative society in which we live in, but for certain cases, it would be best to avoid many sexual partners. The third way would be to get vaccinated for HPV. The vaccine is very effective against several strains of this virus, which causes considerable amount of problems related to HPV. The vaccination involves a series of 3 injections, which are taken over a 6-month time frame. It is estimated that there is around a 99% risk reduction in the chance that a cancer caused by one of the strains covered in these vaccines will develop in a person who has received the immunization or the vaccine. The final way would be to get screened for HPV, as it is important to eliminate the possibility of having HPV or even to treat HPV at the early developing stages. So that is all from us. Thank you all for listening.
What we do here is go back.